Common disorders of submandibular gland, mucoceles, extravasation, mucoceles and retention cysts are formed by mucus extravasation. Both have similar clinical features but variable distinct pathogenesis. Extravasation mucocele. Trauma to the minor salivary gland duct causes accumulation of saliva in the surrounding connective tissue followed by an inflammatory reaction. They occur commonly in children and adolescents and are mainly found on the lower lip. A ranula is a type of extravasation mucokel. Ranula, little frog. Ranula, first described by Bannister in his surgical compilation of 1585, is caused either by the rupture of the main duct or by the rupture of obstructed acini of the sublingual gland. They appear as a characteristic bluish swelling in the anterior floor of the mouth and resemble the belly or air sac of a frog. They can remain localized or insinuate through the mylohyoid muscle to present as a submental swelling called a plunging ranula. They are usually soft, fluctuant, and painless unless infected. Imaging corroborates the clinical diagnosis, and aspiration yields the thick, sticky saliva that distinguishes them from a lymphangioma. Treatment should include a removal of the sublingual gland, as this gland has multiple ducts, and ranula can recur if the gland is left behind. Incision, drainage, and marsupialization have low success rates. Injecting OK432 at the local site produces inflammation and fibrosis. Injection of botulinum toxin has shown a success rate but needs further evaluation. Retention cyst. These result from obstruction of the duct by periductal scars, sialalthesis, salivary glandstone formation, or pressure from surrounding tissue. These cysts are mainly found in the ductal system of a minor salivary gland. The cyst cavity may contain fragments of a sialolith or mucus material. Some may regress spontaneously but are best treated by surgical excision.